So during clinical examination, what the patient might indicate if I ask where the pain is, a patient with FAI syndrome would typically say that the pain is here, deep in the groin, and they make a C with their hands and point towards deep in the groin. So we call this the C sign. And that's quite a typical sign for FAI syndrome or for hip-related problems. I'll first show you the FADIR test, or also called the impingement test. And FADIR stands for flexion, abduction, internal rotation. This test has been described originally in 90 degrees of flexion, around 15 to 20 degrees of adduction, and internal rotation. And this is the impingement test or FADIR test. And when I do this test, I will typically look at my patient if I see any discomfort in his face, or I will ask whether this elicits the typical pain where the patient comes from. But what I usually do is I'll usually test the whole range of the acetabulum and proximal femur. So I will basically go from here to there, to there, to there, and take the whole range into account to here. And then I'll typically ask at which location there's most of the pain. So if you measure the amount of flexion, if somebody has like an anterior problem, so an anterior camouflage or an anterior labral tear, then the range might either be impaired or might already be painful around 90 degrees in case of, for example, labral tear anteriorly. I use is a kind of modification on the FABER test, and it's called the bent knee fall out test. You place the feet at the point of the contralateral knee, and then you ask whether he can bend his knee outwards, and at a certain moment it stops, and then you can measure the distance between the fibular head and the table.